In a world where unseen dangers often lurk in silence, some of the most serious health threats don't come with loud warnings. They arrive quietly, unexpectedly, and with devastating impact. Imagine breathing normally one day and struggling for every breath the next. This is the harsh reality of a rare but deadly illness known as Hantavirus Pulmonary Syndrome. This is not just another virus. It is a condition that can turn mild symptoms into a life-threatening emergency within days. Understanding it isn't optional, it's essential, because awareness can mean the difference between life and death. Today, we uncover the truth behind Hantavirus Pulmonary Syndrome, its symptoms, its risks, and most importantly, how you can protect yourself and those you love. Hantavirus Pulmonary Syndrome is a rare but extremely serious respiratory illness that begins in a way most people would never suspect. It doesn't come from crowded places, contaminated food chains, or direct human contact in the way many other viruses do. Instead, it hides in quiet, overlooked corners of everyday life, places where rodents live and move unnoticed. The danger lies not just in the virus itself, but in how easily it can enter the human body without any warning. This illness is caused by a group of viruses known as hantaviruses, which are carried by certain types of rodents. These animals may appear harmless at a glance, but they can carry and shed the virus through their urine, droppings, and saliva. As these materials dry, they can break down into tiny particles that mix with dust in the air. When someone disturbs this dust by sweeping a floor, cleaning a shed, or opening a long-closed room, they may unknowingly breathe in these infected particles. In that moment, without any visible sign, the virus can enter the lungs and begin its attack. What makes this process so dangerous is its silence. There is no immediate pain, no instant reaction, no clear signal that something harmful has just happened. A person may walk away from that environment feeling completely normal, unaware that a potentially life-threatening infection has already begun to develop inside their body. This delay between exposure and symptoms is what makes Hantavirus Pulmonary Syndrome so deceptive. Once inside the body, the virus doesn't spread in a chaotic or explosive way at first. It moves gradually, targeting the blood vessels, especially those in the lungs. Over time, it weakens the walls of these vessels, causing them to leak fluid into the lung tissues. This is where the real danger begins to build. The lungs, which are meant to fill with air, slowly begin to fill with fluid instead. Breathing becomes less efficient, oxygen levels drop, and the body starts to struggle. Another critical aspect that makes this illness so serious is its high fatality rate compared to many other viral infections. Even though it is rare, the consequences can be severe when it does occur. Medical science has made progress in supportive care, but there is still no widely available specific cure that directly eliminates the virus once it has taken hold. This means that the body and medical support systems must fight against the damage as it unfolds, which can be an intense and challenging process. It's also important to understand that this disease is not typically spread from person to person in most cases. That might sound reassuring, but it also means that the main risk comes from the environment itself. People who spend time in rural areas, farms, storage spaces, cabins, or any place where rodents may live are at a higher risk, especially if those spaces are not regularly cleaned or ventilated. The threat is not always visible. You might not even see a rodent, but the traces they leave behind can still carry danger. What truly sets hantavirus pulmonary syndrome apart is the combination of its rarity, its silent transmission, and its potential severity. It doesn't rely on crowded outbreaks or widespread exposure. It operates quietly, affecting individuals who may never have imagined they were at risk. This is why understanding it is so important, because when something is both rare and deadly, it's often the lack of awareness that makes it even more dangerous. In the end, this illness reminds us of a powerful truth. Sometimes the greatest threats are the ones we cannot see, cannot feel, and do not expect. And the only way to defend against something like that is through knowledge, awareness, and the willingness to take even the smallest precautions seriously. The early symptoms of hantavirus pulmonary syndrome are where the true danger begins. Not because they are severe, but because they are so easy to dismiss. In the beginning, nothing feels extreme or alarming. There's no sudden collapse, no dramatic signal that something life-threatening is unfolding. Instead, it starts in a way that feels familiar, almost ordinary, like the onset of a common viral illness that most people would simply try to sleep off or ignore. It often begins with a deep sense of fatigue, the kind that makes even simple tasks feel heavier than usual. This tiredness is not just about needing rest. It feels different, more draining, as if the body is quietly struggling beneath the surface. Alongside this comes fever, sometimes mild at first, sometimes more noticeable, but still not unusual enough to raise immediate concern. Many people would assume it's just a seasonal flu or a minor infection. Then come the muscle aches, and this is where the pattern becomes more distinct. The pain tends to settle in large muscle groups, the thighs, the hips, the lower back. It can feel like the soreness after intense physical activity, even if no such effort was made. This discomfort can gradually spread, making the body feel stiff, weak, and unusually heavy. Yet, even at this stage, most people still don't connect these symptoms to anything serious. As time moves forward, other signals begin to appear, layering themselves onto the initial discomfort. Headaches may develop, sometimes dull and persistent, sometimes sharp enough to disrupt focus. There can be dizziness, a feeling of imbalance that makes standing or moving feel slightly off. Chills may come and go, adding to the sense that the body is fighting something, but still nothing seems specific enough to point toward a rare and dangerous disease. For some, the symptoms extend into the digestive system. Nausea can set in, making it difficult to eat or even think about food. Vomiting may occur and abdominal pain can follow, creating confusion about what the real problem might be. At this point, it may seem like a stomach issue rather than a respiratory one. This misdirection is part of what makes hantavirus pulmonary syndrome so deceptive. It doesn't immediately reveal where the real damage is happening. The most critical issue during this early phase is not just the symptoms themselves, but how they are interpreted. Because they resemble so many common illnesses, people often delay seeking medical attention. They may take basic medications, rest at home, and wait for improvement that never truly comes. Each passing hour gives the virus more time to progress inside the body, quietly moving toward a far more dangerous stage. What makes awareness so important here is the context. These symptoms alone might not seem alarming, but when combined with possible exposure to rodent-infested environments, they take on a completely different meaning. Someone who has recently cleaned a dusty storage area, entered an old building, or spent time in places where rodents may have been present is in a very different situation than someone who has not. That connection between environment and symptoms is often the missing piece. There is also a subtle intensity to these early signs that sets them apart, even if it's not immediately obvious. The fatigue feels deeper, the aches feel more persistent, and the overall sense of illness feels heavier than a typical cold or flu. It's as if the body is under a strain that cannot be easily explained. Listening to that difference, paying attention to how the body feels rather than just labeling the symptoms, can be a crucial step in recognizing that something is not right. The challenge is that this stage doesn't last long. It is a narrow window, a brief period where the illness is still building, where intervention may be more effective, and where awareness can make the biggest difference. Once this phase passes, the condition can escalate rapidly, leaving little time to react. In the end, these early symptoms are not just warning signs, they are an opportunity to notice, to question, and to act before the situation becomes critical. Because when something dangerous begins quietly, it is often the smallest signals that matter the most. There comes a moment in the progression of Hantavirus Pulmonary Syndrome when everything changes. What once felt like a manageable illness, fatigue, fever, body aches, suddenly shifts into something far more intense and far more dangerous. This is the turning point, the phase where the virus reveals its true impact on the body and where the situation can become life-threatening in a very short span of time. This transition does not always come with a clear warning. It can feel like the illness is simply continuing until suddenly breathing begins to change. At first, it may be subtle, a slight shortness of breath during normal activity, a feeling that it takes more effort to inhale deeply. But this sensation does not stay mild for long. It intensifies, often within hours, transforming into a frightening struggle for air. As the virus attacks the lungs, it causes the tiny blood vessels within them to become leaky. Fluid begins to seep into the air spaces where oxygen is supposed to flow freely. Imagine trying to breathe through lungs that are slowly filling with liquid instead of air. Each breath becomes less effective, less satisfying, and more exhausting. The body, which depends on oxygen to function, begins to feel the strain almost immediately. A persistent cough may develop, sometimes dry at first, sometimes accompanied by a sense of tightness in the chest. That tightness can feel like pressure, as if something heavy is sitting on the chest, making it difficult to expand the lungs fully. It's not just discomfort, it's a signal that the respiratory system is under serious stress. At this stage, the body enters a state of urgency. Oxygen levels in the blood begin to drop, and as they do, other symptoms can follow. The heart may start beating faster, trying to compensate for the lack of oxygen. The skin may become pale or slightly bluish in severe cases. especially around the lips or fingertips. There may be a sense of confusion, restlessness, or anxiety, not just emotional fear, but a physical response to the body not getting what it needs to survive. What makes this phase especially dangerous is how quickly it can escalate. The shift from mild symptoms to severe respiratory distress can happen in a matter of hours, not days. Someone who seemed stable earlier in the day can suddenly require emergency medical care by night. This rapid progression leaves very little room for delay, which is why early recognition and action are so critical. Once the illness reaches this stage, hospitalization is almost always necessary. Medical teams must act quickly to support breathing and stabilize the patient. Oxygen therapy is often the first step, providing higher levels of oxygen to help the body cope. In more severe cases, patients may need mechanical ventilation, a machine that helps them breathe when their lungs can no longer function effectively on their own. This is not just a battle against a virus, it becomes a fight to maintain the body's most essential function, breathing. Every moment counts, and every intervention is aimed at giving the lungs time to recover while preventing further damage. What's important to understand is that the severity of this phase does not always match the mildness of the beginning. That is what makes hantavirus pulmonary syndrome so deceptive and so dangerous. The early stage may lull someone into a false sense of security only for the condition to escalate with overwhelming force. There is also an emotional weight to this phase. The sudden inability to breathe normally can create intense fear, both for the person experiencing it and for those around them. It transforms an invisible illness into a very real and urgent crisis. In that moment, everything becomes clear: the seriousness, the speed, and the stakes. This phase serves as a powerful reminder of how quickly health can change and how something that begins quietly can become critical without warning. It highlights the importance of paying attention to early symptoms and acting before the situation reaches this point. Because once the body begins to struggle for breath, the margin for error becomes very small. And in a condition like this, that margin can mean the difference between recovery and something far more tragic. Understanding how hantavirus pulmonary syndrome spreads is not about creating fear. It's about revealing a hidden pathway that most people never think about. Unlike many infectious diseases that spread through direct human contact, this virus operates through the environment. It turns ordinary places into potential risk zones, not because they look dangerous, but because of what may be present without being seen. The primary carriers of hantaviruses are rodents, and not just any rodents, but specific types that can carry the virus without appearing sick. These animals live quietly in fields, forests, farms, and even inside homes or storage spaces. They move through walls, roofs, and hidden corners, leaving behind traces of their presence in the form of droppings, urine, and saliva. To most people, these signs might seem like nothing more than a cleanliness issue, but in reality, they can carry a serious health risk. The virus does not spread through casual contact like touching a surface or being near someone who is infected. Instead, it becomes dangerous when these rodent waste materials dry out and break apart. Over time, they can mix with dust and become part of the air in an enclosed or poorly ventilated space. When that dust is disturbed by sweeping, cleaning, moving boxes, or even just walking through the area, tiny particles can rise into the air. These particles are so small that they cannot be seen, and they can be inhaled without any awareness. This is the most common pathway of infection: breathing in contaminated air. It sounds simple, but that simplicity is what makes it so dangerous. There is no immediate warning, no smell, no visible cloud that signals danger. A person can enter a space, spend a few minutes cleaning or organizing, and leave without realizing they may have just exposed themselves to the virus. Certain environments carry a higher risk than others. Rural areas are often more affected, especially places where human activity overlaps with rodent habitats. Farms, barns, sheds, cabins, and garages are common examples. Any space that is rarely used or left closed for long periods can become a nesting ground for rodents. When those spaces are reopened, especially without proper ventilation, the risk increases significantly. Even within homes, hidden areas such as attics, basements, and storage rooms can become risk zones if rodents find their way inside. The danger is not always obvious. You might not see a rodent at all, but the evidence they leave behind can still pose a threat. Old boxes, unused furniture, and cluttered corners can all become places where contamination builds over time. Another factor that increases risk is the way people respond to these environments. Many people instinctively sweep or vacuum when they see dust or droppings, not realizing that this action can actually make the situation worse. Sweeping dry materials can send contaminated particles directly into the air, increasing the chance of inhalation. What feels like cleaning can unintentionally become exposure. There are also indirect ways the virus can spread, although they are less common. For example, touching contaminated surfaces and then touching the face, especially the nose or mouth, can potentially lead to infection. In rare cases, rodent bites may also play a role. However, inhalation remains the primary and most significant route. What makes this mode of transmission unique is that it depends heavily on behavior and environment rather than direct interaction with other people. It places responsibility on awareness, on recognizing which spaces might carry risk, and understanding how simple actions can either reduce or increase that risk. This knowledge changes the way we look at everyday surroundings. A quiet storage room is no longer just a storage room. A closed cabin is no longer just a peaceful retreat. They become environments that require caution, preparation, and respect for what might be present. The key is not to avoid these places entirely, but to approach them with the right mindset. Knowing how the virus spreads allows for smarter decisions. Ventilating a space before entering, using proper cleaning methods, and taking protective measures when needed. In the end, the risk is not in the rodent alone, but in the invisible connection between their environment and human behavior. And once that connection is understood, it becomes possible to break the chain of transmission before it ever reaches the body. Prevention is where control returns to your hands, because when it comes to Hantavirus Pulmonary Syndrome, there is no widely available specific cure that can simply eliminate the virus once infection takes hold. That reality shifts the focus entirely away from treatment and toward protection. It means the smartest, strongest move is not reacting after exposure, but preventing exposure from happening in the first place. The foundation of prevention begins with understanding that rodents are the central link in the chain. If their presence is reduced or eliminated, the risk drops significantly. This starts with something simple but powerful, making your environment less inviting to them. Rodents are drawn to food, shelter, and access. When those three elements are controlled, their activity naturally decreases. Keeping living spaces clean is essential, but it goes beyond basic tidiness. Food should always be stored in sealed containers, not left exposed where it can attract unwanted visitors. Even small crumbs or open packaging can invite rodents into a space. Garbage should be disposed of regularly and kept in tightly closed bins. The goal is to remove any reason for rodents to stay. At the same time, attention must be given to how they enter. Small openings in walls, gaps under doors, cracks in foundations, these may seem insignificant, but for a rodent, they are open doors. Sealing these entry points is one of the most effective ways to prevent infestation. It turns your space from accessible to protected, reducing the chance that rodents will ever establish themselves inside. But prevention is not only about stopping rodents from coming in, it's also about handling situations where they may already be present. This is where many people unknowingly increase their risk. When they see droppings or signs of rodent activity, the natural reaction is to clean quickly, often by sweeping or vacuuming. However, this approach can be dangerous because it stirs up dust and sends potentially contaminated particles into the air. A safer method requires a different mindset, one that prioritizes caution over speed. Instead of dry cleaning, surfaces should be treated with disinfectant solutions. Spraying the area first helps to dampen any particles, preventing them from becoming airborne. Wearing protective gear, such as gloves and masks, adds another layer of defense, reducing the chance of inhaling or touching contaminated material. Ventilation is another critical step that is often overlooked. Before entering a closed or unused space, like a shed, cabin, or storage room, it is important to let fresh air circulate. Opening doors and windows and allowing the space to air out for a period of time can significantly reduce the concentration of any airborne particles. It's a simple action, but it can make a meaningful difference. Time and patience also play a role in prevention. Rushing into a dusty, enclosed environment increases risk, while taking a few extra minutes to prepare creates a safer situation. It's not about fear, it's about respect for what cannot be seen. The virus itself is invisible, but the conditions that allow it to spread are not. Recognizing those conditions is what turns ordinary actions into protective ones. Outdoor areas should not be ignored either. Keeping grass trimmed, removing clutter, and storing firewood away from living spaces can reduce places where rodents might nest. The fewer hiding spots available, the less likely they are to settle nearby. Another important aspect of prevention is awareness within daily habits. It's about being mindful when handling old boxes, cleaning rarely used areas, or working in environments where rodent activity might be possible. These moments, which often feel routine, are where the greatest opportunities for prevention exist. Ultimately, prevention is not a single action. It is a consistent approach. It's a combination of small decisions that together create a strong barrier against risk. Each step may seem simple on its own, but when practiced regularly, they form a powerful line of defense. In a situation where treatment options are limited and the consequences can be severe, prevention becomes more than just advice, it becomes responsibility. And the strength of that responsibility lies in knowing that even the smallest precaution can protect something as vital as your breath, your health, and your life. Awareness is often underestimated, yet in the case of Hantavirus Pulmonary Syndrome, it becomes one of the most powerful tools for survival. This illness does not spread widely enough to dominate headlines every day. And because of that, many people live their lives without ever thinking about it. But that lack of attention is exactly what makes it dangerous. When something is rare, it is often ignored, and when it is ignored, it catches people off guard. The reality is that this condition does not give much time once it fully develops. The window between early symptoms and severe respiratory distress can be very short. That means the decisions made in the early stages, whether to seek help, whether to take symptoms seriously, whether to connect those symptoms to possible exposure, can shape the entire outcome. Awareness is what drives those decisions. Without it, people are left guessing, delaying, and hoping that what they are experiencing is something minor. One of the most critical aspects of awareness is the ability to recognize patterns. On their own, symptoms like fever, fatigue, and muscle aches may not seem alarming, but when they appear after time spent in environments where rodent exposure is possible, they form a pattern that should not be ignored. Awareness allows someone to make that connection. It turns random discomfort into a meaningful signal, one that calls for attention rather than dismissal. There is also a psychological barrier that awareness helps to break. Many people are conditioned to downplay their symptoms, to push through discomfort, or to wait for things to improve on their own. This mindset can be dangerous in situations where time is critical. Awareness challenges that instinct. It encourages action instead of hesitation. It replaces uncertainty with informed judgment. Another powerful role of awareness is how it spreads beyond the individual. When one person understands the risks and shares that knowledge with others, family members, coworkers, communities, it creates a ripple effect. A single informed individual can influence many, helping others avoid the same risks or recognize the same warning signs. In this way, awareness becomes not just personal protection, but collective protection. It's also important to understand that awareness is not about living in fear. Fear can paralyze, but awareness empowers. It provides clarity. It allows people to continue their daily lives, working, cleaning, exploring, while taking simple precautions that reduce risk. It shifts the mindset from this could happen to anyone at any time to I know how this happens and I know how to protect myself. In many cases, the difference between recovery and tragedy is not just medical treatment, it's timing. And timing is directly influenced by awareness. Recognizing symptoms early leads to earlier medical care. Earlier care increases the chances of managing the condition before it reaches its most severe stage. That chain of events begins with a single moment of realization. Something is not right and it needs attention. Awareness also sharpens observation. It makes people more attentive to their surroundings. The presence of rodent droppings, unusual dust in closed spaces, signs of infestation. These details, which might otherwise go unnoticed, become important signals, and once they are noticed, they can be addressed before they lead to exposure. There is a quiet strength in being informed. It doesn't require advanced knowledge or complex training. It simply requires the willingness to learn, to remember, and to apply that knowledge when it matters. In a world where many threats are visible and obvious, Hantavirus Pulmonary Syndrome stands out because it is neither. It operates in silence, in hidden spaces, and through everyday actions. That is why awareness becomes the ultimate defense. It fills the gap between what is seen and what is unseen. It prepares the mind before the body is ever at risk. And in doing so, it creates a level of protection that no treatment alone can provide. Because in the end, the most dangerous threat is not just the virus itself, it is the moment when it goes unrecognized. And the most powerful response is not panic, but understanding.